It's PGA Week in Louisville, Kentucky. The PGA is here, and all the big names are playing at the Valhalla Golf Course. I want to talk a little bit about Tiger Woods. He's actually playing this week. He was involved in a horrific auto accident, May 15th, 2021. Horrible accident. Here's some images of his vehicle. They had to remove him from his vehicle. The vehicle was turned over. You can see all the extensive damage done to the vehicle. It was reported that the vehicle was traveling about 85 miles an hour when he was going around a curve, and he kind of lost control of the car and went off the road. In orthopedics, typically the higher the speed, the more damage that's sustained to the vehicle usually translates into the more damage or injury to the human body. Sometimes not, but most of the time there's a direct correlation. He sustained multiple lower extremity injuries. Now this is not his true x-rays. These are an example of his x-rays. This is a segmental fracture involving the tibia and the fibula. You can see a fracture line here, there's a fracture line here, fracture line in this region of the fibula. When there's more than 2 or 3 fracture planes, we call it comminuted. And when it's in more than one area of the tibia, it's called multisegmental. So he had a multisegmental tibial fracture. He also had multiple fractures of his metatarsals at the time of injury. I would hypothesize that he must have put on the brake and was pushing on the brake very hard. The vehicle rolled, which is what fractured the foot. And then the force was translated up into the tibia, and this was on the right side, which is the side that used the gas pedal and brake on, and he sustained this fracture. So he was rushed to a medical center, was taken to surgery. His diagnosis for his tibia was an open comminuted segmental tibial fracture. Open means that the bone is sticking out of the skin, and there's some type of laceration to the skin, which puts the fracture at a much higher risk for getting infection and for not healing. So he had an open fracture, multisegmental tibial and fibula fracture. They ended up inserting a rod in the tibia, and again, this is not his actual film, but this is what's called an intramedullary rod. We make an incision right at the knee. We drill and open up this canal area to make it uniform, and then we insert a rod, and we put 2 screws at the top and 2 screws at the bottom to stabilize the rod. Because there was so much soft tissue damage to his leg, he started developing a lot of swelling in the leg, and they had to do what's called a 4-compartmental fasciotomy, where we go in and we make 2 fairly long incisions, one on either side of the leg, and with a pair of scissors, we release the fascial compartments. We have 4 fascial compartments, and those were released because of the amount of swelling he sustained in the lower leg. He then went on to develop post-traumatic arthritis. Before I move to the next slide, I want to talk a little bit about tibial fracture types. The Gastillo-Anderson classification for open tibial fractures, it's based on how much energy was sustained, the type of fracture, and how big the wound is. Based on what I could read, it seems like he had a type 3A open fib fracture based on what I could read in the literature that's out in the World Wide Web, which is a pretty high or bad fracture to have. He then went on to develop post-traumatic arthritis involving his subtalar joint in his right foot. This is an x-ray. This is a side view of the foot. This is called the subtalar joint right here. This is the calcaneus. This is the talus. So below the talus is subtalar. And this x-ray looks great. That's a normal looking subtalar joint. It's got a nice space there. This is a subtalar joint, and the red circle shows where the arthritis is located. And this is a procedure that Tiger Woods received. It's a fusion where large screws are inserted across this joint line that's arthritic, and you fuse that joint so there's no micromotion in that area. He's here today. This was shot this morning at Valhalla Golf Course. And here is Tiger Woods getting ready to drive the ball. Remember, it's his right lower extremity. Looks pretty good. It's incredible what these elite athletes, how they can recover. Take normal human with that degree of injuries, there is no way they would go back to playing any sort of competitive golf, maybe even not recreational golf. But here he is at the PGA.